My name is Dr. James Underberg. I'm a clinical assistant professor of medicine at the NYU School of Medicine and the director of the Bellevue Hospital Lipid Clinic. I'm a clinical lipidologist and a general internist. Today, my program here at CMHC focused on the importance of LDL lowering. LDL cholesterol is a risk factor, its role in cardiovascular disease genesis and prevention. First, I spent some time going over the epidemiology of LDL cholesterol, what we know about it with regards to genomic studies. Patients who have very low LDL cholesterol levels from birth seem to do very well, and patients with very high LDL cholesterol levels, depending on the particular mutation, develop early premature atherosclerosis, often in the setting of familial hypercholesterolemia. This has been shown in several different studies with different mechanisms. One with the Niemann-Pick-C1-like-1 receptor, which is the receptor that is inhibited by ezetimibe. And recently we know ezetimibe has been shown to reduce additional cardiovascular risk when combined with statins in the IMPROVE-IT trial. But also in patients who have mutations in a protein called PCSK9. PCSK9, when patients have mutations that cause a loss in function, actually have very low LDL cholesterol levels and seem to have a reduced risk of cardiovascular disease over the course of their lifetime. Patients with very high PCSK9 levels from birth, gain-of-function mutations, actually have familial hypercholesterolemia. It's one of the ways that you can develop FH. So, given the appealing nature of the genomic models and the pathophysiology of PCSK9, a variety of different techniques have been developed to inhibit PCSK9. The one that is closest to development stage right now is the use of monoclonal antibodies, in particular human or humanized monoclonal antibodies, depending on the product being developed. And in recent phase 2 studies looking at the efficacy of PCSK9 inhibition, very dramatic reductions in LDL reduction have been shown, anywhere from 40 to 60%, depending on the dose of the particular PCSK9 inhibitor utilized. These drugs have been used as monotherapy in the development program, combined with statins, in patients with familial hypercholesterolemia, both heterozygous and homozygous, and in patients with statin intolerance. And in all cases, the results have shown a very persistent, significant reduction in LDL cholesterol that appears to be durable and lasts over a long period of time. In trials now, we've got data that go out beyond a year with these particular agents. What's most exciting and interesting is that recently 2 of the drugs in development have shown that in their safety data analyses, there have actually been reductions in cardiovascular events, and these p-values are significant. Now, these trials were not prospective trials meant to look at heart disease risk reduction, so that you can't draw much more from this other than proof of concept that combined with the genomic data and the very interesting and excellent safety data associated with these drugs, that we're nearing a time when we may have an entire new class of medications available to us to use in the management of patients with severe cholesterol disorders, potentially statin intolerance, or patients at high risk who can't get to goal with traditional lipid-lowering agents. All in all, it's a very exciting time to be practicing and doing research as a clinical lipidologist, and it was an exciting program. I was glad to be here today in Atlanta at CMHC.